Interestingly, I had a tick exposure in the months and the weeks leading up to my symptoms. I also was diagnosed with quote unquote long COVID, mercury toxicity, extensive antibiotics for the anaplasmosis. Actually got diagnosed with Lyme. I had a mold exposure in my house.
I call this a perfect storm.
Yeah.
A lot of people are getting different fillers now, breast implants of the lips. And
here's my opinion about that. So I'll go back to what I said earlier, which is, the science is always evolving.
Dr. Landon Pryor, a board-certified plastic surgeon. What sets him apart isn't the scalpel. He is redefining healing for women suffering from breast implant illness, bringing science, empathy, and full-body restoration to the forefront.
At his state-of-the-art facility, Dr. Pryor helps women reclaim their health and identity.
Could something called BII be the reason why you don't feel well, meaning fatigue, brain fog, gut problems, autoimmune, bizarre stuff? What is BII? Could you have it? Oh, the answer is, well, maybe if you have breast implants, okay, because it's called Breast Implant Illness. And I'm telling you, this is all the rage in a maybe bad way right now, but I'm here with the expert, Dr. Landon Pryor. Thank you for being here. And you are one of the top in the world, I would say.
Thank you. I appreciate that. And it's great to be here with you.
Yeah. Thank you. This is a controversial subject. And by the way, y'all are going to want to share this because I would say everybody watching this right now has friends with breast implants, family members, loved ones. You have to hear this show because we've done some other interviews together. And I can tell you, I have a desire to bring this to the world, this message. Because
you and me both.
Yeah, exactly.
It's an important message that's not being talked about enough.
Absolutely. People, just as I started this show here, people unknowingly have a lot of symptoms that are associated with breast implants, and they're clueless. They're unknowing to them. And, that breaks my heart. I know this is controversial because breast implants become an identity thing. And I don't say that in any negative way, that this is human, right? And taking them out or even considering that it could be why you have fatigue as an example, more pain, etc. That is a big, big emotional topic for people. Would you agree?
Yeah, absolutely. I mean, women get breast implants for a very specific reason. They're usually self-conscious for whatever reason about the appearance of their body. They want to feel better. They want to feel more confident. So they get implants to try to solve that problem. But a lot of times what they're not told about is the risks related to breast implant illness, which is what we want to talk about. It's one thing to make a decision to get breast implants knowing that there's these potential risks so that if down the road you develop symptoms, to get treated. Problem that's happening, at least in this day and age, fortunately, it's getting better as people are becoming more and more aware of breast implant illness because of awareness that you're bringing, people like me and people on social media and on the internet that are able to communicate now about their experiences with breast implants. But, even 5-10 years ago, this was something that nobody was talking about. And that wasn't really part of the discussion when patients would come in and get breast implants. And that's really what prompted me to become more of an advocate myself for women that are getting breast implants or women that have breast implants, because like we'll talk about in my own journey from pain to purpose.
We're going there.
It really just, like you said, broke my heart to see patients that were suffering unnecessarily, that have had symptoms sometimes for years or decades, and they knew nothing about breast implant illness. Nobody talked to them about it. They would go to their doctors, get tests done, everything came back negative. They were told, and we'll talk about all the different typical things that they hear, but generally they end up in my office after many years of suffering. And as a last resort, they're finally learning about breast implants and have to come to the realization that they may need to get their breast implants out to feel better.
And that's emotional. Look, we're going to talk about everything from why not everybody? Why are some people sick, some people not? What's the leg? What's the difference? What about silicone? What about saline? We're going to talk about all that in a minute. But I want to back up a second. I want for people to know who you are, because for someone to make a jump to putting breast implants into taking them out, there has to be a story around that. Of course there is.
Yeah, it's interesting. And, I went through a very traditional medical education process. Went to college, went to medical school, went to residency. I did 5 years of general surgery and plastic surgery, your very typical plastic surgery.
Why did you decide to be a plastic surgeon? What was that? How did you get there?
That's a really good question. So I went to medical school with the intention of, wanting to help people. That was always my kind of core belief, and always wanting to contribute to the best way that I could to humanity. And to me, that was through, practicing medicine. And then as I got into the medical field, I realized that surgery was much more of a field that resonated with me. It was very results oriented. It was technically challenging. I thought that, specifically plastic surgery gave me the ability not only to help patients functionally improve, but also improve their quality of life, which was a lot of what drove me into plastic surgery. I really was grateful for the opportunity to work with patients and have them actually feel better. So really my training in plastic surgery was, had a foundation in reconstructive plastic surgery, which we call, helping patients with form and function. And so I was trained to put breast implants in like most plastic surgeons are in residency. And I started in residency in 2002. And this is actually during the breast implant moratorium. And it was towards the tail end of my residency. And what that means is silicone implants were off the market for a period of time because concerns of breast implant illness. And
this
so,
was what, 2002, you're saying?
So I started residency in 2002. I started plastic
when
surgery
did that
residency.
happen? When they were
1991.
Oh.
And they were off the market until about 2007.
Yeah, see, I didn't even know that.
Yeah.
Okay.
So for a long time, they were off the market. This was the whole Connie Chung thing, and she brought some awareness to breast implant illness. This has been going on for decades. My breast implant illness advocate, Laura Bowden, she's been an advocate since the 90s for women with BII. And, we can talk about that. She was on Oprah back in the 90s. Talking with the CEO of Dow Corning at the time. So this is not anything new. It just kind of keeps coming back in different forms. And now that, the social media has really catapulted the visibility of BII, much more into the lay public space, it's becoming something that people can no longer ignore.
Yeah.
But to answer your question, I was trained, like most plastic surgeons, on how to do a breast augmentation, and that, implants were safe. So, I don't think anybody's intentionally doing anything nefarious
I agree.
putting implants in with the perception that they're causing any kind of harm. But I think, as science gets better and we get more information, to know better is to do better. And in my own experience, after having put implants in, once I started in practice in 2009 for a few years, I became interested in this smaller space at that time of breast implant illness. And it was really specifically a patient that came in to see me that we did a appropriate, capsulectomy implant removal, and like a miracle, she got better after surgery. And I'm like, wow, this is like, there's really something here. And, we can't deny what we're seeing as far as the outcomes with these patients. And then that really kind of just organically grew. And I saw more and more patients with breast implant illness that came to see me for proper removal. And, patient after patient I saw get better after removing their implants. So much so that, around that time in 2018, I was invited to speak at a documentary that was being filmed in the suburbs. And they reached out to a number of plastic surgeons, actually I think all the plastic surgeons in Illinois, to come and speak at that event. And I was the only one that showed up. And, in preparation for that, and, even to today, I, made sure I understood everything about breast implant illness. So I really went on a deep dive to understand, the science behind it, what's true, what's not true, what are the world leaders saying about breast implant illness. And, hearing obviously the stories from my patients, and now from, these advocates, Laura specifically, and her friends and colleagues in the explant space who have been dealing with breast implant illness now for 30 years. She brought me like this bag of all this old information that she had from the 90s and the 2000s of VHS tapes and articles and, all these
VHS tape. It's old when.
Right. All these old resources.
At least it wasn't a cassette reel.
We joke about it all the time. She literally brought me like a duffel bag full of information. I said, give me everything you have about breast implant illness. I really want to dig into this and understand it from a scientific perspective. And so I did that. And, really from that point on, and with Laura's help as an advocate in this space, we really built up this explant practice. And, it wasn't too long after that, I came to the own personal conclusion that, I'm a physician, I've taken an oath, obviously do no harm. And I personally just was not comfortable continuing to put implants in because, there's the possibility that these patients could be getting sick after surgery. And to me, wasn't worth, doing that. I couldn't sleep at night.
I run from a little different philosophy in that I think, look, I've seen this over the years. Anything in the body that's absolutely not from the body eventually goes bad, right?
Absolutely.
It just takes, some people it might take 10 years, 20, 30 years, but I've seen this again and again. So it's a matter of the body being healthy enough to adapt to that stress, because it's a stress. It's not your opinion, my opinion, or anyone else. You put something foreign in like that,
absolutely,
it is a stress. It's a matter of if your body's adapting or not. And that's the answer to the question of why isn't everybody sick with breast implants? Well, right now they're adapting. I've dealt with the same thing for silver fillings, right? That made me sick, that contained 50% mercury. Well, my cousin has them in. Why aren't they sick? Well, look, those leach mercury into the brain 24/7, right? So, when will that happen is the question. And I feel this is the same subject.
Absolutely. There's a article that was published in 2011, and I was actually just on a call with this, thought leader who is overseas talking about breast implant illness specifically, but he was a lead author in an article on, you probably familiar with ASIA, autoimmune inflammatory condition induced by adjuvants. And so specifically in that article, and this goes back, 14 years, they're talking about breast implant illness and other adjuvants that including, vaccines and all types of things we can talk about.
Those are things that just excite the immune system. Matter of fact,
that's all it is.
In vaccines, they're designed to excite the immune system.
That's what it's for, right? Yeah, it's designed to create this inflammatory process in the immune system. And the example I like to tell patients is, I can do the exact same surgery on two patients. Somebody develops a keloid and somebody else has an imperceptible scar. Why? Well, it's a lot of factors. Obviously people have certain genetic predispositions to developing hypertrophic scars from inflammatory immune responses, but also lifestyle factors, epigenetic factors, like I'm sure we'll talk about, play a role as well. So it's not all people are created equal. Some people are more inclined to get breast implant illness depending on their bucket, as you like to say, their environmental factors, chemical, physical, emotional stressors, microbiome, DNA, it all plays together. And I think it's all just this new science that's coming out that you're helping to raise awareness about, you and others that I follow and learn from. And, to me at this point in 2025, we're seeing what's happening with the new administration, with these MAHA reports coming out, understanding, really, in my opinion, how the world's working, there's toxins coming into our bodies from all over the place, right? Our food, our water, our air, our products. All the things that you talk about.
And this is one of the things I like to say, here's our bucket, they're filling, right? And when you're as filled as that,
take much.
My team over here is going, oh my God, stop. But you see, it doesn't take much stress to make that overflow, right? And I believe the number one thing that will determine if someone does get sick from breast implants, amalgam fillings, a moldy home, is how filled their bucket is. But genetics still play a role, right? Some people have genetically bigger buckets. They can handle more stress, meaning, right?
And MTHFR, that's something we can talk about, and other, genetic predispositions.
Yeah,
but people are different. I think the stressors obviously are big. That's what your program focuses on. Yeah. And I should probably say, I don't know at what point this would be appropriate, but I've been through your program. I'm currently a member of your program. That's how we,
this is true.
That's how we actually got introduced. And it was totally serendipitous. This wasn't planned by any means. I had my own, and this is why we're on this program.
Exactly. Let's tell your story. Because you ended up in my program because you ended up with symptoms. Yeah. And like you said, I was finding myself, this is your words, with the same symptoms that people were coming in with breast implant illness. So obviously you didn't have breast implants.
I was already an expert in breast implant illness and all these things that we're talking about. And all of a sudden I was like, man, I got brain fog, fatigue, post-exertional malaise. Yeah.
I had every one of those.
Yeah. So that was, what led me to find you in August of last year when I was, being my own advocate, even as a physician, trying to find answers like these patients do. This was really kind of my aha moment as it
makes us better doctors, though, doesn't it?
It does.
Yeah.
It definitely changes the perspective. And I've had to do a lot of work over the last year, work on myself, work on, what I'm bringing into my body, my thoughts, all the things that affect the stressors that fill the bucket, right?
Yeah.
So it's not like one thing that just all of a sudden causes you to be better. And it's not one cause that's causing you to have symptoms.
Absolutely.
So,
that bucket is filled with many stressors that once they overflow.
In retrospect, and it took a lot of introspection to kind of piece this all together and connect the dots. But, like you, kind of a perfect storm of events. Interestingly, I had a tick exposure in the weeks leading up to my symptoms. I also was diagnosed with quote unquote, long COVID, mercury toxicity. And I was on extensive antibiotics for the anaplasmosis from the tick exposure, kind of plus or minus whether or not I actually got diagnosed with Lyme. I had a mold exposure in my house. I had emotional stressors.
I call this a perfect storm.
Yeah.
And the bottom falls out. You end up with all the symptoms that.
Yeah, it was a lot all at once. And, I was previously healthy and all of a sudden your body just cannot compensate to all of the stressors coming in.
Exactly. Right.
And so I'm like, okay, I've been to traditional doctors at this point. I'd been to my primary care doctor. I'd actually been to a functional medicine doctor. I'd been to integrative medicine doctors. And, I'm resourced, I'm knowledgeable. I can do my own research. Yeah. And so thinking of it from a patient's perspective, it's like, what would these patients be doing and what would I be doing if I didn't have the resources that I do? If I didn't have the medical knowledge or background that I did, if I didn't have the access to great physicians that I did. And I'd been to endocrinologists and neurologists and, kind of the typical experience of our BII patients. And, I wasn't coming up with a whole lot of solutions. And even though
and none of them were probably, they weren't asking the right questions.
Yeah.
They weren't even looking or digging for cause typically. They're asking about symptoms and then they're thinking about drugs to give you for the symptoms.
Yeah. And even the integrative medicine doctors, it's like, oh, you've got dysautonomia. Or, great. How does that help me?
Right. Mast cell activation.
Now what do I do?
Work on your gut. Okay. Yeah. How's this helping me? Right.
Yeah, exactly. So it was very frustrating. And so I turned a lot to doing my own research and identifying people that I thought were spreading the right message and, had it rooted in science. Obviously, as a physician, I also am very much into the scientific method. I understand science is always evolving and changing, but, I wasn't prepared to just start making decisions about my health on things that I couldn't validate with, medical information. So I came across your program and right away, and I'm not just saying this, and, I got Ian in the back of the room. I mean, you heard me say this. I was like, wow, this guy knows what he's talking about. Like everything you're saying and everything your program taught, totally resonated with me. And I was like, this is really treating the root cause. I mean, and it's great because it's simplified to a way where anybody can really understand it. And your process takes people through it in a way that's manageable and not overwhelming and empowers the patients to make decisions for themselves. So really from day one, I was like, wow, this guy really knows what he's doing. This program is so well organized. And I'm not just saying that. I was singing your praises around the office. I'm like, this guy's got it figured out. I want to do a program.
Well, you were in my program. I didn't know who you were. I didn't know you were in my program. Right. And it's like, and then all of a sudden someone said, you got to hear this guy's story.
And then this is like a spiritual moment, but I reached out, I finally connected with your coach and just in kind of the intake process, she was like, so what do you do? Meanwhile, apparently she already knew. She had done her homework that I was a plastic surgeon and I was into BII. And I know that your program focuses on BII. And by the way, it's one of the only programs in the detox world that I know of that specifically talks about and focuses on detox from.
Look, I mean, we are looking up. Look, I can say this: we're the only program out there that really is focusing on cause. Right. That's why we need guys like you. That's why we're here today. Right. Homes making people sick. We have a group of dentists. Right. We need a group of you. Because getting to the cause is how I got my life back. How you're getting to your life back. Right. So that's why we're here, man. So thank you.
Yeah, absolutely. And so in talking with your coach, she was like, oh my God, I can't believe you do explant surgery. She's like, thank you so much for what you do. And by the way, I have breast implant illness. And I think you know this.
Yeah.
And I'm scheduled to get my implants out, next month. And I was like, we talked about that a little bit. And then literally the next conversation we had, she said, will you do my explant surgery?
Yeah. It was like,
And,
you help her helping you helping her.
Yeah. And so, just to give you like a bit of a real live story. So she had BII. She had a lot of symptoms of BII. She had been through your program. So she did the whole, detox for 4 or 5 months prior to her explant surgery. She went from, probably a dozen or a couple dozen symptoms. And we, like you, we have like a intake form. So we know what patient's symptoms are. And, from the time that she started with your program to when she got explanted, she was down to like 2 symptoms. And then we did her explant surgery. And, at this point, she's like 6 months out from surgery. Her symptoms are completely resolved. And she's lost like probably 20 or 30 pounds and she feels great. And so, you can't, like we say, we can't make this stuff up. I mean, it's like, and it's even
get to the cause, the body heals itself.
When even if we can't prove that implants are causing your symptoms, which we can't, and I
can't prove that your silver filling is causing your symptoms.
Right. And we're very transparent about that. We talk about that in the informed consent process. We have to make sure the patients know what they're signing up for. But even if we can't prove that the implants cause your symptoms, taking the implants out or, a de-challenge as it's called, and your symptoms go away, that's pretty indicative that there's a cause and effect relationship, right?
Absolutely.
So it's like, what would somebody say that doesn't believe in BI? Oh, well, it's all psychosomatic, or it was all in their head, or it's placebo effect. But, at the end of the day, if these patients, first of all, I don't believe that.
Yeah. I think we're beyond that, even as a scientific community. But needless to say, I think if you have them in, you might still be holding on to that. Maybe. I don't know.
Yeah. But I mean, if the implants come out and the symptoms go away and the patients feel better and they're able to get back to their, lifestyle, I mean, you see these patients just heal literally overnight. Their relationships recover, their relationships with their significant others, with their families, with their lifestyle, with their jobs. I mean, their whole life kind of comes back together, like yours did, like mine did. I think, Ian can attest for this. Like, there's been a lot of changes in my own personality just in the last year since I've really focused on, being the best version of myself, not only physically, but emotionally, mentally. And obviously it takes a lot of work. Like I said, it isn't.
And by the way, you're in my program now and you see I'm detoxing, right? My alarm went off. Like here's all my pills. I'm doing my own program.
In plastic though.
Exactly. Though, if it was hot or acidy or thing, I'd be very concerned, right? But it's not like it's going to jump out necessarily. But, point is that these toxins accumulate in our body. And that's the issue, right?
Yeah.
And that takes time, number one. So you could have breast implants for a long time and all of a sudden it starts. You could have silver fillings, all of a sudden a moldy home, and all of a sudden it starts because there's an accumulation and, the immune system's going this way and eventually boom. And again, back to this simple example, one day the bucket overflows, but it was filling that whole time. And it was all of the stressors, not just the implants.
And then what happens is, these patients, they go to their typical doctors. They don't get answers. They're told, like I was, you're under stress, you're depressed, you're going through menopause, but it's not your implants. You've got, chronic fatigue syndrome, rheumatoid arthritis, some other kind of non-specific inflammatory condition. Take steroids, take these anti-inflammatory medications, and you'll be fine.
Yeah.
And this goes on.
This is typically how it goes every time.
And I've had patients that have had, back surgery and other surgeries and neurologic symptoms and diagnostic tests. And, they come in and their medical records are like a binder this thick.
Because they've been chasing it for 10 years,
And
20.
a lot of times, I hate to say it, they go back to their plastic surgeon and say, what do you think about this maybe being for my breast implants? And no, it's not your breast implant.
Well, first of all, especially if he's the person to put them in. It's like, what's he going to say? Yeah, absolutely. It's like,
if somebody were to come back to see me now, 10 years later that had symptoms of BII, we would have that tough conversation about the possibility.
Well, because you're in a different place though.
Yes.
If you're still actively putting breast implants in, what are the chances of, someone coming to you and say, hey, my fatigue and all this pain that I have, could it be related to that? What are the chances of saying, yeah, it could be? I mean, when you're still putting them in, I don't know.
I think, it comes down to setting the stage and setting expectations, from the very onset. So this doesn't happen for patients for months and years without them knowing. So, if somebody wants to get breast implants and they go through an appropriate informed consent process, and, the physician tells them, the risks of getting breast implants are A, B, and C, contracture, rupture, something called breast implant illness. This is what it is. This is probably what's causing it. This is how you would treat it if you were to develop symptoms. Just kind of keep that in the back of your mind so that if you do develop symptoms, we can treat you. I mean, to me, that is an appropriate way to put them in.
I doubt we're going to just stop putting them in. I doubt it's going to be banned. Okay. Right. So, but therefore, that should be what should be.
That's the goal for me, as far as raising awareness.
If it's just as like there's something called breast implant illness, and that is a possibility here, meaning that's informed consent, right?
Absolutely. I don't think that anybody's saying breast implants are evil or anybody's doing anything, like I said, intentional. But I think, definitely patients need to be informed about the possible risks involved with putting implants in.
Where we start.
We're in 2025 now. I think, that there's plenty of scientific data from research that's been done all over the world related to breast implant illness. And I don't even think that it's you said controversial earlier on in the show. I don't even think it's really that controversial anymore.
Well, in my mind, in the scientific world, it's not. However, when you have this conversation with people,
in certain circles,
it becomes controversial really fast. Yeah.
I think in certain circles, it's still considered, controversial, especially in circles of people that are continuing to put implants in. But I think, if you actually look at the science, you look at the research, you look at the clinical data, and you look at the patient experience, I mean, we're talking tens and tens of thousands of women worldwide that have been explanted, that have been studied, that feel better after surgery. To me, that shouldn't be a controversial topic.
Mm-hmm. Yeah, absolutely. Okay, let's talk. There's two different types of implants. Maybe there's more, but in my simple mind, I think of the silicone implant and the saline. Is one worse? What's the dangers of one versus the other?
Yeah, that's a good question. And I think the short answer is, I don't know. But what we do know is that, like you said, if you put a foreign material in the body, you're going to develop an inflammatory response. So regardless of whether that foreign material is a hip prosthesis or a silicone implant or a saline implant. Now, I think the difference between saline and silicone as it relates to their pathophysiology of symptoms is probably different. I know you talk about hidden infections, mold, heavy metal toxicity, with the implants, both types of implants. Yeah. And so I don't have the scientific data to say, saline implants cause these symptoms because of this reason, or silicone causes it because of that reason. But I think, one of the misnomers is, even though it's a saline implant, it's a silicone shell. Yeah. And that shell has a valve, and that valve is how you put the saline into the implant. That means that, in my opinion, it's potentially higher risk for colonization of molds, of bacteria. It's very well known and very well documented about biofilms in breast implants and other types of prostheses.
Yeah, and by the way, when people you mentioned a hip implant, right? A titanium. Yeah. There is study after study. I think I got into this with my father-in-law. And I said, no, look, I went on PubMed and I showed him all this research about biofilms around these implants, right? And the potential problems. And it's like the science is out there.
What's what I'm saying?
Because he asked his doctor and the doctor said, no, there's no problem.
We've been talking about biofilms as it relates to breast implants for decades, since I've been in practice. So almost 20 years. It's always biofilm. But that's,
Let me back up, because people, we're saying a word that people are going, like, what is that? Okay. So the body will form biofilms around something. We have biofilms in our microbiome, even to protect our good bacteria. But biofilms can be loaded with bad guys, bad bacteria, bad pathogens. And when something foreign goes in the body, these biofilms form, and therefore pathogens will be attracted to that.
Absolutely.
And they become immune driving.
And it also evades the immune system.
Yeah, because they hide in the biofilms.
Exactly. Yeah. So, the immune surveillance is compromised when you have these biofilms that are present. So that's the most common hypothesis right now for capsular contracture, which in my opinion is kind of a precursor potentially to breast implant illness. And even taking it a step further, as the body becomes more inflamed, you get more symptoms. You maybe develop the C word, the C monster, as time goes on. That's very well documented now too. I mean, 5-10 years ago, nobody was talking about the association between breast implants and cancer, right?
See, I like the fact that he used the C word because we can actually put this on social media.
Yeah, I figured there's a reason everybody says the sea monster.
Exactly,
so
depends on what platform, blah blah blah.
Okay,
but,
so as far as the sea monster goes, and I've learned that from you and all your colleagues and watching all of these videos about these topics. But it's a continuum, right? You get inflammation causes capsular contracture, more inflammation, maybe you get breast implant illness, you get symptoms, more inflammation, you get, turning on, like you like to say, of these genes that can predispose patients to developing different types of cancer. So specifically, the thing that we talk about in the plastic surgery literature is ALCL. That's very well known now. That was not something anybody talked about previously. So
and tell them what that is.
So it's called anaplastic large cell lymphoma. So it's not a breast cancer per se, but it's a cancer that actually forms in the capsule, in the inflammation itself around the implant. And so it's very rare based on the scientific literature, but it's definitely a known risk of getting breast implants. There's also other kinds of cancers that can form in the capsules
and
around
again,
implants.
that should be informed consent, but it's not.
Informed consent, I think that's, very kind of surgeon specific. I think it's, maybe disclosed in some of the documentation that patients sign prior to surgery.
They don't read. Yeah.
In the packet of, informed consent information. But, so we know now, taking breast implant illness aside, let's pretend BII wasn't even a real thing, that there's the potential to develop cancer in the capsules around implants from the implant. I think everybody would agree on it at this point. And that's just a end result of an inflammatory process. And so the way to treat that is to remove the implant, remove the capsule, obviously make sure that there's no underlying hidden cancers, and then, reconstruct the breast as needed.
Yeah. And again, who's more predisposed to that? Obviously genes can play a role, but all people that immune system is very distracted already, and they're not adapting to this foreign stress.
Yeah, absolutely. It's I loved how you make these analogies so simple to understand, even for plastic surgeons like me that aren't into all of the biochemistry. I mean, I wish you had your whiteboard so we could.
Yeah, right. Exactly.
We could go through the perfect storm and the three-legged stool and all that kind of stuff.
I think we should keep one of my whiteboards down here just for fun. Yeah.
But that it's just, it makes so much sense. So for me personally, with my own medical knowledge, combined with my surgical expertise, combined with my, experience doing explant surgery. And then I would honestly say, like, what I've learned through my own personal experience, personal journey with an inflammatory health condition and how to detoxify from it, in a large part based on your work. I feel like I have a lot of valuable information that I can now offer patients that are going through a similar journey.
Mm-hmm. Yeah. Yeah, look, I think that you going through the journey is all part of the pain to the purpose, because you became better when you went through it yourself.
Yeah,
you
absolutely.
now are sitting across from someone going, yeah, I know what that feels like, right? It definitely opens up our heart, but it also, it allows us to truly understand, like to be on the other side. I mean, you can't go to school for that.
Right. Well, first of all, it humbles you, right? I know,
Yeah,
you know it. I've been through it. I mean, obviously it makes a big difference, but, also when I was doing, these surgeries previously, I was doing it very much from the perspective of a surgeon. Like, you've got a problem, I'm going to fix it. It's very kind of cause and effect, but it's different to do it from the perspective of the patient, having been through the journey, knowing what they've been through, knowing, the frustration that they must be feeling, the hopelessness that they're feeling, the fear, that they're feeling because, they've been to doctors. They don't know they don't know what's wrong with them. They don't know if the surgery is going to help them feel better.
It's a horrible feeling.
And, like we talked about earlier, they all got implants because they wanted to feel better about themselves. And now we're talking about taking their implants out. And what's that going to look like? I mean, that's a big consideration that, is an emotional stressor. We know that, surgery itself is a physical stressor. All of these things compound.
I do want to unpack that a little bit, because I know that on the other side of this is a woman who is going through that right there, right? There's an identity, emotional issue that has to be addressed. In your experience, how does that unpack, right? Meaning, like, how do you get them through that? How do they get through that? Typically, what do you see? Because I already know right now a handful of women who have a suspicion that their breast implants are making them ill. And the conversation I have is they're worried about what their husband thinks. They're worried about, I'm sure, how people view them, right? I mean, and this is what is at the root of why they haven't taken the step yet. What do we say about this?
Yeah, it's not what people want to hear. You know, and even after having been sick for years, for decades, a lot of times we've got a Kleenex box in the consult room, because as soon as, we tell patients, we can't guarantee you're going to get better by taking your implants out. But what I tell patients is, based on our clinical experience now of having done this hundreds of times and having seen the results of thousands of patients worldwide, I think we can get you to feel better after surgery, but we got to take the implants out. We got to address that issue. And it's going to be definitely a perspective change, in that you have to come to grips with the way the breasts are going to look. And, it's not something patients are excited about.
We can talk about what to do, because there's things you can do. I mean, you reconstruct this.
Yes.
So, so that's part of the conversation is, well, okay, hold on a second. You're not going from, you're not going to look the way you look now, which we can all tell a breast implant from a natural breast anyway. So, but you're going to perhaps go to this. What is this, and how do you get them there? And what's the difference?
So the first thing, I think, like we do in plastic surgery with everything, whether we're talking about rhinoplasty, tummy tuck, or, explant surgery, is setting appropriate expectations. So, I tell the patients from the very beginning, this is going to be a physical change. This is not something that I can replicate the way the breasts are going to look, without implants. But obviously, my primary goal number one, is to get you feeling better. That's why you're here. That's my goal. So I want to take out these implants, take out the capsule, really like I'm removing a cancer. That's where actually the term en bloc capsulectomy comes from. It's from oncologic surgery. So, we're treating this, in my opinion, like a cancer. We want to get out all of that tissue, all that inflammatory tissue, give the patients the best chance of healing and feeling well. But then the question is, how do we reconstruct the breast in a way to maximize the appearance? Right. So to me,
if feeling well is the first goal,
that's the first goal.
I mean, when someone's really sick, it's always the first goal, but almost equally, what it looks like afterwards is as big of a concern.
Yeah, it is. I mean, I would say most patients, kind of setting the right expectation, like getting you feeling better is my number one priority. And then I'll do my best as a plastic surgeon to make the breast look as good as possible. And they're comfortable with that. But obviously everybody wants, the best aesthetic result possible. So the ways to answer your question, we can do that.
And by the way, a lot of people before we leave the explant part of it, they leave because you said it's like getting rid of cancer. That subject, you can't leave anything behind. Some people leave the capsule behind, which is really a problem, right? In some of the muscular tissue, right? So, that has to be done right.
Yeah, I just want to be clear. I'm not saying we're removing a cancer. I'm saying we're removing it like
that's
a
the
cancer.
analogy, meaning though, if anything is left behind, that's not good.
It's a potential nidus for infection. It's a nidus for inflammation. It's a potential risk for recurrence of symptoms. I've seen plenty of patients that have been explanted without a capsulectomy or out of proper capsulectomy.
That's why I'm making the point that this can't just be this. They're gone now. I've watched a lot of people not get well. They end up going back in, and it all wasn't removed, and then that was the thing.
And just so I think you understand this, it's a much bigger surgery. It's a bigger surgery. It's a bigger recovery. There's more risks. There's more costs. I mean, there's a lot that goes into doing the right surgery. All right. It's very easy to make an incision, go and pull the implants out and close.
Right. I just didn't want to gloss over that. It has to be done right.
It's a really important point because that is a big reason why I think some women are reluctant to go through the surgery, because it is an extensive surgery. There's a lot of risks involved. Yes. It has to be done with somebody that has experience doing those kinds of surgeries. Yes. And then it also makes the reconstruction harder. So the way that we can try to make the breast look better without obviously putting another implant back in. Right.
What's done now, this is what they want to hear.
Yeah. So obviously, usually after implants come out, there's loose skin. Sometimes there's not, but we have to address the skin issue. Many times the inframammary crease, which is the crease in the bottom of the breast, has been disrupted from the prior breast augmentation. So that has to be reconstructed. The pectoralis muscle, which is the muscle that's typically the implants go under in submuscular breast augmentation, has to be reconstructed. And then we have to address the volume loss. So patients that, are wanting the breast to be fuller with more shape and have appropriate, what's called donor site fat, or somewhere we can get fat from, we can actually do autologous fat grafting, where we borrow fat, just like liposuction, harvested and then use that to re-inject into the breast to give it the shape that would be more similar to having an implant.
How much of that? I'm literally trying to think of questions they would ask, right? How much volume can we get out of that? How much fat can you put in? And then part 2 of that question is, won't my body eat some of that fat? So even if I start at this cup size, will I end up at less? 2 questions.
Yes. So the answer
I'm
is...
trying, folks. I'm trying to get all the questions you have.
So the answer is, yes, we set those expectations. We're not going to get 100% fat graft survival. I usually set the expectations at 50%.
Okay.
And that's probably conservative. It's probably a little bit more than that, depending on who's doing it and how you're doing it. But, and also the breast tissue is only, depending on how much soft tissue there is only going to accommodate so much fat. So usually I set the expectations, even if we're taking out a bigger implant, which is, call it like 300 or 400 cc's. Think of it like maybe half a liter. We're only going to be able to reconstruct maybe 100 or 200 cc's with your body's own fat.
So half the size then?
I usually tell patients it's the equivalent of like a small implant. So we're taking out an implant, we're taking out 300 or 400 cc's of volume, and we're replacing that with maybe 200 to 300 cc's.
I don't even know cup size thing.
Yeah.
You do. Okay. So what cup size are you striving for with the fat?
1 extra cup size.
Okay.
So, they're going to have a baseline cup size depending on what their natural breast tissue is. Some women still have a lot of natural breast tissue even after explant surgery.
Okay.
And so those patients actually, have better results from an aesthetic standpoint because there's more to work with.
Okay.
The really challenging patients are the ones, and this is a lot of women that have gotten breast implants. Why do they get breast implants? Because they're so thin.
Yeah.
They don't have a lot of breast tissue. Take the implants out. It's typically skin over implant. There's not a lot to do to reconstruct. And a lot of these women are very thin. They don't have appropriate donor sites where we can get fat from. So it's a challenging, surgery, and it's a challenging conversation with patients sometimes to set expectations because, obviously the breasts are going to be different. But, to your point, our goal in helping patients feel better is removing the cause, right? We got to get the implants out.
Absolutely.
We got to get them on the pathway to healing. We got to get the body working correctly.
Right.
We got to get their energy metabolism working. We got to get their detox processes, working again. And so in order to do that, we got to remove all that inflammation, starting with the implants and the capsules.
Right. Yeah. Exactly. And at least there's hope that, you're going to have something there. It's not like you're taking your breast implants and you're going to be just absolutely flat chested.
Sometimes they are.
Yeah, to your point, a super skinny girl that doesn't have a lot of body fat.
Sometimes they are,
transfer.
and there's actually something that is popular online now called the flat closure. It comes from breast reconstruction, and so also a lot of women that had prior, talk about a double whammy, had prior breast cancer, so they had a mastectomy. Then they get the breast reconstructed with an implant, which creates further inflammation.
Gosh.
And, obviously there's no breast tissue in those patients. So now they're coming in with symptoms of, they've already had breast cancer. Now they've got all these additional symptoms, but they've also been through potentially chemotherapy and radiation and, they have other health comorbidities. So they really don't know what's causing what. Is it the implants or is it related to the prior surgery and reconstruction and all of their ancillary treatments? But, those patients actually have to get the skin removed and have the breast be closed flat like you would after a mastectomy because there's literally no other option. There's nothing to work with.
Right. What are the most common symptoms that you see with this?
It's the same thing that I experienced, same thing that you experienced. It's actually pretty amazing that it all culminates in the same types of symptoms. So, what I experienced in my own health journey is very similar to what these patients experience, which is why it's so close to me. But, brain fog is a big one.
Yeah.
Sleep, fatigue.
Weird anxiety because it's compensating for the lack of cellular energy.
Pain, chronic fatigue type of stuff, fibromyalgia. We see a lot of neurologic symptoms. We see a lot of dysautonomia, so inability to sweat. We've talked about that before. Dry eyes. Sometimes they go on to actually develop actual autoimmunity, so they'll have that associated diagnosis, autoantibodies, Sjogren's, Raynaud's. Weight fluctuations, typically weight gain, from the chronic inflammation.
Isn't it crazy? Like all toxic people, they start gaining weight and can't lose it, right?
And then, I have a number of patients that I've done surgery on that literally have lost, like you would think they're on like a weight loss drug.
Yeah.
Like literally after the surgery, within like weeks, they're down 10 or 15 pounds.
Yeah.
And then they've gone on to lose 30, 40, 50 pounds.
Well, it's like when we start emptying people's buckets, right? And we start getting this stuff out of their cells, all of a sudden they're like, I'm losing weight. It's like, I'm eating the same. I've changed nothing. Your cells are now becoming functional again. Your hormones are connecting into your cell. You're hormone sensitive again, because the big reason why people have no energy, they can't lose weight, is because their cells are literally deaf to hormones, right? And they're trying to take hormones, and that doesn't work either.
Yeah.
So,
Yeah, absolutely. And then, you add on, people are feeling better. So they're being more mindful about their lifestyle choices. Maybe when you don't feel well, you're depressed, you lose purpose, and you make bad choices, right? That's where addiction comes in. That's where people have problems with, lack of motivation, eating, poor food, social media addiction, all the things, lack of movement. So, you solve the underlying problem, people feel better, and that actually goes on to also cause them to improve, a lot of these lifestyle choices that's contributing to the symptoms and the emotional toxicity that they have from everything else going on in their life.
Yeah.
So it's really amazing taking like a 30,000 foot view of what's happening to these patients as they're going through this journey with BII, having been there now myself to really understand what are the different components that they're dealing with. It's not just, like you say, it's not just the breast implants. That was kind of the icing on the cake, right? But they had a lot of these issues.
Absolutely.
The comorbidities, maybe the genetic predisposition, maybe these other sources of inflammation, dysbiosis, microbiome disruption, autonomic dysregulation, immune dysfunction, emotional traumas, all of these things fill their bucket. And, you got to poke holes all over this bucket.
That's what makes my job hard, because I'm telling them that, it's all of it. Right. Every bit of that filled their bucket, right? So we have to knock all of it off, right? It's like we have to go through and start emptying the bucket with the detox. But the problem is they've had all these exposures in their life.
And then the question is, and for me too, it's like, where do I even start? Like you Google, I'm tired, I'm fatigued, I'm not sleeping well. Well, you're not going to get anywhere with that, right? So how do you even start? How do you know what process to follow, in what order, in what sequence? There's so many things that factor into just helping us feel better, right?
Yeah.
Like movement, sleep, air, the basics, healthy food. Where do I start with all that? And again, your program just kind of lays it out in a way that is really very simple for patients to understand. It doesn't require a whole lot of thought. You just listen to what your coaches tell you.
Everyone needs a coach. That's It's like, I always say, if I got sick again, I would hire one of my own coaches. I would hire, because you can't think through your own shit. You just can't. It's so hard. It's like you need to be guided through it, because it's like otherwise you just get caught in your own circles. It's horrible.
And you have to have, the number one resource that you're following, you have to believe that they're reliable and credible. Like you could follow a lot of these people online, but they may not lead you to success, right?
Yeah.
So,
if it were only, I always say, if detox were only so easy of just sitting in a sauna or doing the 10-day cleanse that practitioners give, and it's not that easy.
It's not that easy. And, I see in your support groups and, people writing in on other forums online and in the BII community, it's like, well, this person said this and that person said that. And how do I do this? And how do I do that? And it's, unfortunately, it's not necessarily one right way. It kind of depends on the individual patient situation.
Yeah. We start with a core and we individualize it.
Yeah, exactly. And, it's the same thing that we do, but it's tough to really, help these patients because everybody's so different. And like you said, you really need to have somebody that's going to be your partner through this journey.
Yeah, you do.
Because without my background, without my knowledge, without my, my interest in learning more about it, and my experience with breast implant illness and chronic inflammation, I would have been in the same boat as a lot of these patients, which is, going from doctor to doctor, getting tests done, and then it's like, okay, well, I guess I'll just be on medication the rest of my life, and that's that's no way to live. And so kind of going back from pain to purpose, having been through the pain relative to, my functioning prior to that, for me, it's really important to make sure that, we're helping people just live their best quality life.
Yeah.
Whether it's through, aesthetic surgery. Sometimes aesthetic surgery can be great for helping people feel better about themselves, going on to having improved quality of life, improved relationships, improved involvement in their community. All of these things work together, obviously, to make people feel, better about themselves and be more engaged in their life and with their families. But, with patients that have sickness, it's really important to figure that out and get on the right track.
Yeah. Why, we touched on this, but I want to go a little deeper, the type of toxins that are in these implants that are making people sick, right? We already said that anything foreign can drive these biofilms and infections, et cetera, and the body knows it's there. That can drive this inflammatory reaction throughout the body. But what else is going on here that's making people sick, and what type of toxins are we dealing with?
Yeah, if I had the slide here, I would show you. I actually have a slide that goes through all of the different toxins that are actually in a silicone breast implant. And there's probably like 30 heavy metals and other chemicals.
Well, I always say, ask the manufacturer of your breast implant and go online and you'll see the ingredients. They all contain heavy metals. Why?
I couldn't believe it.
I know.
Like going from
I couldn't believe it.
Putting implants into, and when I first saw this, I was like, are you sure that's right?
That's what I said. Because even me, I was like, why? Because I just couldn't figure it out. Like, why do they all have heavy metals? I don't get it.
Yeah. And we know, this has been studied in pathology and other rheumatologic circles, that those leach into, the capsules,
of course,
around the implants.
Yeah.
It travels to lymph nodes in the body. You can have systemic symptoms, related to the toxicity of the metals in the body, and like you said, mold and other hidden infections. I love your analogy with the odontoid ligament and wisdom tooth removal, but it's it's the exact same thing. And if you're not removing all of those contributing factors, patients just aren't going to get better.
No. And then there's the fact, okay, what about the silicone, right? The silica, it's releasing, I've read studies on, they're finding this in the human body. Talk about that.
Yeah, it's. I don't think that's controversial.
No, it's not. It's studied,
I've seen plenty of research. There's silicone that's found to be migrated, and this is without a rupture.
Yeah.
So obviously, with the rupture, there's a couple different kinds of ruptures we could talk about: intracapsular, extracapsular. Usually, if an implant ruptures, that means the shell breaks down. It's contained within the wall of the capsule, which is your body's defense mechanism to prevent it from spreading. But even with that, a lot of these chemicals actually leach into the capsule. From there, they go into the lymph nodes. From the lymph nodes, they travel to other areas of the body, and they can cause, direct inflammation and symptoms there as well.
And why does mold form? You mentioned the valve on saline, but
yeah, I think mold's going to form anywhere where there's a potential opportunity for movement, and so the mold's able to actually get into the valve where you inject the saline. And, in my opinion, that contributes to, mold in the implant. We've actually seen implants that have mold inside the implant. So the mold is, gone from the implant through the valve and actually into the saline within the implant. So you've probably seen these pictures online where, you take out the implant. Patients don't know anything about it. They don't have like an imaging study or anything showing it ahead of time. All they know is I don't feel well. And then you take out these implants and they're just covered in mold. You could Google it online.
Yeah, I know.
It's heartbreaking.
Crazy. Well, I talk about biotoxic illness, which is mold illness, right? And I talk about hidden infections,
right,
as making people sick unknowingly, right? And then I talk about heavy metal toxicity, right, and how that makes people sick unknowingly. And most alternative doctors don't approach it correctly. Breast implants have all three of these warnings that I give people, right? The hidden infections, the biofilms, you name it, the heavy metals, the mold. My gosh, it's a triple threat.
Like you said, it's a foreign body, right? So that in and of itself.
Yeah, right. It's exactly. That in itself
even
is
without
bad.
Even without those other, issues, and you got this foreign body in the body, your body is responding to it like it should. It's causing inflammation. From the minute that you make an incision, your body's creating that inflammatory cascade. And then, like I said, in some patients, that inflammatory process doesn't shut off, or, they don't have, like you said, the compensation mechanisms to prevent the development of symptoms.
Yeah, you know what, like a new problem that's starting to happen, and this is just in that same line of thinking like, we should have thought of that. Hernia meshes. So it's like, this became something, it's like now people are looking for new ways to do it without the mesh because they're realizing it forms these huge biofilms. It ends up disrupting the immune system, causing all these pathogen issues. It's like, yeah. So now I can't tell you how many cases we've had where it was like they get the hernia mesh out and like all their pain goes away, all their problems, it's like, so like, again, anything foreign.
Yep.
Yeah.
I would reference anybody that wants to read a great article to this 2011 article by Talbert and Schoenfeld. It's actually called Schoenfeld syndrome after the last author in the paper.
Could you send me the link to that?
Yeah, I'll send that link to you. But, that talks about the ASIA that we talked about, autoimmune inflammatory syndrome induced by adjuvants. And it goes through these one by one: breast implants, hernia meshes, hip prosthesis, and there's obviously others there.
Yeah.
And I was like, it's all right here.
Yeah.
And this is a whole nother topic. This was actually presented at the FDA not that long ago. All this information. And here we are today.
Yeah. It's like, right. It's not our opinion. So because believe it or not, when you do things like this, there'll be a doctor out there that'll be like, that puts in these and they take it very personal. It's like, it's nothing personal. It's like, I don't even criticize anyone's putting them in because they probably just don't know, right? They just need to read that and go, okay, yeah, I'm going to investigate a better way, right?
Yeah,
so it's not a personal attack against anyone who's doing any of these things or putting in any of things, not a personal attack.
I hear this all the time online on your channel. And it's true. When I was in medical school, you know how many nutrition classes I had?
Zero nutrition classes. And so, obviously, like I said, to know better is to do better. Yeah, exactly.
The science is always evolving. We're not talking about, the Newtonian physics anymore. We all know about quantum mechanics and, we're all energy beings and, really what causes health, what causes sickness, what causes disease. And, I just think that physicians need to be open-minded to the possibility that if it may not be something that they learned in a textbook in medical school.
Yeah, exactly.
Mind you, those books were probably written, 30 years ago. So a lot of these things take time to actually get integrated into the medical curriculum.
So nothing personal. Don't send the long email. We're going to work with you, not against you here. Nothing personal.
Yeah. And there's all kinds of new research, new science coming out every day. And it's obviously available now based on, all of the awareness on the internet. And so I think people that are serious about wanting to be, the most progressive in their field, whether it's plastic surgery or anything else that kind of goes back to thinking outside the box, lifelong learning, being receptive to other people's perspectives, and, trying to make the best decisions for your patients, even if it's not what you were taught in medical school and residency 20 or 30 years ago.
Absolutely. It is okay to move from crap, we didn't do great. Let's do better, right?
You could make a change and say, I've looked at, and this is what I did. I've looked at the information, and this surgery no longer resonates with me. This isn't something I want to continue to do based on my current knowledge and understanding of the way that implants behave in the body.
Are you training any doctors in explant?
So that's actually kind of getting from pain to purpose. One of the things I really like to be able to do is I've kind of thought about, what my legacy, so to speak, is going to be, moving forward after having recovered my health. For me, doing explant surgery or being an advocate in the explant space is probably the best way that I can use my resources and my talents to help other people. So I really want to do that through the lens of service to others. And so, for me, being able to, train other surgeons, and, I'm fortunate to be able to be in a healthcare environment where, we have the ability to kind of grow and scale nationally. So right now we have our kind of flagship location in Rockford, which I built, from scratch.
Chicago and now in
Florida. Palm Beach. Yeah. And so I'm building the explant practice down there as part of our Breast Implant Illness Centers of Excellence. And really the goal is to build this, national footprint of experts in the explant field, doing breast implant illness, surgery, one, obviously to help as many patients as possible, two, to educate the next generation of surgeons. Because I do think we're going to see a shift, hopefully, with, younger surgeons coming out, understanding, a little bit more of the nuances of breast implants and how to manage patients with breast implant illness.
Dr. Rob Whitfield is another pioneer here.
Great guy. We've talked many times. We've got similar experiences in
he's
in
in
plastic
Austin.
surgery in
You're
Austin,
in Chicago and Florida, Palm Beach. But matter of fact, tell them how to contact you.
So if you're, even if you just want information about breast implant illness or explant surgery, we've got a great team of advocates both in Rockford and in Florida. My advocate Laura is in Rockford. My Advocate Yvette's in Florida, but Breast Implant Illness Centers of Excellence. .com is our website. So from there, obviously you can submit an intake form and we'll reach out to you and provide information. Obviously there's no commitment. We want to just provide a resource and information for patients that are thinking about either getting breast implants or getting their implants out and kind of what to do next. Is this the right surgery for me? And, what are the things that I need to consider before I make that decision?
I think, a team of women around this, like Dr. Katie Seuss, Andy Liu, she wrote the book Treasure Chest. Yeah, amazing people, right? And there's others. Yeah. I feel like if I make the whole list, skip anyone, but that's huge because they'll hear it from them. I think because they have an incredible story. Whereas they're not going to hear it from me necessarily.
Yeah, no, there's lots of great resources online. You got to just know, what you're listening to, because not everybody has all of their information validated by science, like you do and like some of these other thought leaders do. Yeah. So, definitely do your homework. Get as much information as you can. Yep. And make a decision that's right for you. It's all about informed consent.
Yeah, absolutely. Thanks for being here. I mean, this is...
Is that it? We can go on for another hour.
Yeah, well, I was going to want... Is that it? I was going to ask this one. So I'm because you said that, I'm going to ask
Yeah, what's the bonus question?
Yeah, the bonus question is this. A lot of people are getting different fillers now. This is kind of like, breast implants of the lips and the cheeks.
You saved the best for last.
Yeah. So what about that? What's your take?
Here's my opinion about that. So I'll go back to what I said earlier, which is, the science is always evolving. I think the issue with breast implants has been around for a long time, going back to the 90s. And so we have a lot more information about breast implant illness and, scientifically validated information about the potential harms of breast implants. Now, conceptually, I think, like we talked about, anytime you're putting a foreign body into the body or you're doing anything to the body, whether you trip and scrape your knee or you're getting a needle in your face or you're getting, a filler or surgery or whatever it is, dental surgery, doesn't matter. The body perceives it as a trauma that causes inflammation. But
it's one thing when the needle's in and gone. It's the other thing when it's there and
stays there. And so these are all what I would consider micro traumas, right? And I would say, the vast, vast majority of people have the ability to compensate for that, right? I mean, that's putting a drop in the bucket, and that's not filling up your bucket.
It's a drop in the bucket.
Drop in the bucket. It's like a strenuous exercise. It's an oxidative stress, and your body recovers, and you probably aren't going to have any symptoms from it. But going back to my point, I think that should be part of the informed consent process. I think that by and large, most patients can have those types of injectables and procedures and do fine.
But a lot don't. I used to hear the stories there too.
What's really interesting too
is like the filler, because they used to say, oh, it just stays local in that thing, but they're learning that it's spreading out and they see it on MRIs other places. And it's like, oh.
I think there's a fine line between talking about something that's been now well studied and documented and trying to, I really don't want to have people be afraid of, getting treatments that potentially help them feel better. It's just about doing it in a way where they understand the risks, the benefits, and the alternatives to treatment. And I've never personally seen anybody that's gotten any kind of injectable that's developed symptoms, but, maybe we're not asking the questions.
Yeah, I have, but in all fairness, it's because they find me. You know what I'm saying? I mean, there's something wrong. And, they kind of said, well, let me tell you my story, right? So again, I personally would never do it because I don't like foreign things in the body. I think it's adding to the bucket, small or large. It's a stress, and if your body's already stressed, forget.
Yeah, and I think that goes to patient selection too. So, and this is actually in that 2011 article I'll send you. Patients that have a predisposition to allergies, personal family history of autoimmune diseases. We know there's probably some immune dysregulation there. Yep. Those are probably not patients that, you want to be, putting something forward in their body. And especially, I'll conclude with this, as it relates to breast implants and the injectables. Okay. We've seen patients develop different kinds of unusual symptoms post-COVID. Whether, and I know you talk about this, but that's a whole nother discussion point, but, talk about revving up the immune system, whether it was, vaccination related or just, having the virus itself.
It was a weird virus that our immune systems never saw.
Right.
That, we actually inherit, education, information from our parents' immune systems, right? From nursing from our mothers, our microbiome transfer, et cetera. And it knows how to deal with viruses, right? Not this one. We got no information from mom.
And so we've seen a lot of patients, and I think that's part of the reason that breast implant illness is becoming increasingly popular, for lack of a better word, is people are more sick. When I was going through this, and I talked to a lot of professionals in the wellness space, I mean, their clinics are exploding with patients with these types of symptoms, all similar symptoms, all post-COVID. Quote unquote long COVID, a lot of these COVID long haulers.
Yeah. But see, you proved my point though of this, right? Meaning that what COVID did is it brought people closer to the top. And now all of a sudden the breast implants that their body was tolerating, dealing with it, right? Now it's not. And now the bucket's overflowing, right? So COVID really stressed the immune system.
Yeah,
on many people,
still
even those that weren't vaccinated, everybody.
Yeah, everybody.
Yeah, just and by the way, we were just on the last few weeks with a group of scientists that most of their research is in Europe and in India because they can, but it's called spike protein persistence.
Yep.
We're realizing that people who were vaccinated and people who just got COVID a bunch of times.
And it causes symptoms.
And they're producing these spike proteins continually, and we can't shut it down.
And there's things you can do for that too. There's
we're doing
spike
it.
Protein
that's why we're
detoxes.
working with them, because we're adding these spike protein detoxes to our program and our detox, because we're realizing that they get so challenged, they end up with so much mast cell activation, et cetera, et cetera. If we don't deal with the spike protein problem, then we can't get to all these other stressors and toxins.
Yeah, that was one of the things they tested me for. It's like you got long COVID, your spike protein's elevated. So it's all comes together.
Yeah. I mean, and this was so controversial at one point, we couldn't even mention these things on social media.
We not even that long
taken
ago.
Down. I mean, how corrupt is that?
A few years ago.
Not even that long. Yeah. It was like, gosh, if you said anything about anything regarding COVID, you're shut down.
If you said the V word,
exactly. Red flags everywhere. It's like, oh my gosh, it's like, you don't have a problem with that. I have a big problem with that. So anyway, this is a really, I'm glad we ended there, because that's a big deal. But again, a lot of people don't know what's happened since then. They got COVID, right? It's like, the vaccination, whatever. And they're like, what is wrong?
What's wrong with me? I don't feel right. And that's what we hear all the time. So, but thank you for the work that you've done and what you're continuing to do, because it's really helping a lot of people. Yeah.
Well, I appreciate it. And we need a team. We need a group. We, like I said, we need the environmentalists, people that go in and look at homes, right? Because that's where people get sick. We need a group of dentists who are dealing with hidden infections correctly and the mercury, all the issues. And we need a group of surgeons like yourself dealing with.
I think there's a lot more momentum and a lot more similar-minded thought leaders than maybe you initially anticipate. Because I talk to a lot of people now in the space, in the holistic space, and people are really into this non-traditional treatment for illnesses. And I think, like you said, 3, 4, 5 years ago, you couldn't even talk about it online.
Yeah, absolutely. My own concern in alternative medicine, functional medicine now is it really has moved, I feel like, further away from getting to the cause of this, only because it's not easy. It's not easy sitting across from a woman and saying, it could be your breast implants. Like that's not an easy conversation. They would rather take the expensive functional medicine tests, right? The genetic tests, the blood work, all of it, and then be handed some supplements. Like that's a lot easier, and people want that, right? But going, I think your fatigue could be your home. I think we need to bring an expert in to figure out what's going on in your home. Well, wait a minute. That might mean, that could lead to.
Can I just buy a supplement to take care of that?
Can I just buy something? Or hey, could be your breast. It's not easy, but dang, man, it's like I didn't get my health back by a supplement, right? It's like I didn't get my health back by a diet. I got my health back by removing the interference.
Yeah, and it's like we said, it's not one thing, and patients have to be patient, and obviously go through the right surgery if they're suffering from breast implant illness. But it's everything. It's you got to, like you said, get your cells working the right way. We didn't even say like your favorite line on this.
I know, fix the cell to get well.
Fix the cell to get well.
So, because that's where real detox is, right? And everything we're talking about, like activation of the immune system, all these things, that's a cellular issue, right? I mean, that's a cellular issue.
It all is.
My R number 1,
remove the source.
Exactly. And it could be right here. Yeah. It could be the breast, could be here, could be your home, right? But we have to remove the source, and then the other R's are how you fix the cell to get well. So, well, look, you need to share the show, because you know how many people, they don't feel well. And it absolutely could be this causative factor. Upstream, they're trying all these downstream things, and it could be you that sends them this show. Like it always, and add some comments in. It really helps us spread this information. So thank you. Another episode of the Dr. Pompa Podcast, From Pain to Purpose.
You and me
Always
both,
look for
brother.
your purpose in the pain, right?
You and me both.
Yeah,
Absolutely.
always look for your purpose in your pain.
That's right.
No matter what, it makes you better. So thanks for tuning in.